This is San Diego's news channel, KUSI News.
Yeah, great skin starts from the inside out. So Dr. Melanie Palm, a dermatologist in San Diego, is stopping by with some of the latest treatments that you need to know about in the new year and what to put in your body to keep your skin looking good. But first, we're talking about great skin, and it really starts from the inside out. During the cold and dehydrated winter months, it's so important to keep your skin healthy. Dr. Melanie Palm is joining us this morning with some great tips to look beautiful in the new year. Good morning, doctor.
Good morning, Alexis.
So is that the key? I mean, it's really what you put into your body that reflects how your skin looks?
It makes a huge difference. The nutrients you put in and the toxins, too, show up on our largest organ, which is our skin. So there's some simple things you can do at home. I believe in everything in moderation, but there's some great things you can do that are easy to add into your day-to-day and kind of start off that 2013 year on the right start.
So first off, go to the gym like you promised that you would, right?
Yeah, so we have some workout gear and a nice yoga mat. So getting your blood going helps circulation, brings that flush to the skin, removes the toxins over time. And then what you're putting in your food is really important, or what you're putting in your mouth is really important too. So there's superfoods, you know, citrus fruits that have vitamin C, vitamin E, and that's in nuts is great. They also have omega fatty acids in them. And then leafy greens, things like that have beta carotene in them, and they're great for skin. Anti-inflammatory and really help in terms of cell turnover.
I'm into the juicing. I'm a total believer now. Okay, but you can also do vitamins and supplements as well, right?
So if you've been bad, especially since we're in the post-holiday season, doing a multivitamin. And then in particular, biotin is great for hair and nail health. I recommend that a lot for patients if they're experiencing problems, and good for skin as well.
Okay, and I have one of these right here because you said it was the best thing ever. Explain what this is.
So this is Sunforgettable. It's from Color Science, and it's mineral-based sunblock, and so it has zinc in it. It's endorsed by the Skin Cancer Foundation, and this one's even got a little bit of a shimmer to it. You just brush it on and it gives you great coverage. It's really easy to throw into a purse or throw into your car.
Because ultimately you have to protect your skin.
Exactly, that's so important. 90% of our wrinkles comes from sun exposure and UV damage, so even winter months you want to protect it.
Okay, so there are a few treatments that if you're doing all this stuff and you want to try something else, explain what Sarah's getting done.
So if you're done sort of with at-home treatments and you want some professional help, I have our esthetician Candace doing something called Dermasweep, which is a new procedure. This is step above microdermabrasion. We're showing the second step. The first step is a crystalless microdermabrasion. This one is the infusion, so it actually deeply penetrates into the skin, giving you vital nutrients. This happens to be a vitamin C packet that we're putting in the skin as an antioxidant boost to really help with collagen and pigmentation. But there are preparations for anti-acne, hydration, all sorts of different things to sort of tailor to your skin's needs.
Does it hurt at all?
No, it feels really nice.
It feels like a massage. And this is something totally non-invasive. I mean, like a lunchtime
non-invasive,
procedure.
no downtime. Okay. So, and your skin feels baby smooth afterwards. It's fantastic.
Looks great. Okay, so, and what about Stacy over here?
Yeah, so something that's done by a physician. We're going to talk a little bit about Ultherapy and just do a couple pulses. This is an ultrasound-based technology. You can see just like what we do when we're monitoring a baby's progress during pregnancy. You can see the ultrasound device up here. And it's used to penetrate down below the skin, down below the fat, to our connective tissue, which becomes a little bit more saggy over time, and that gives...
It happens, yeah.
Yeah, skin laxity. So we'll show you a couple pulses here. You can see I've marked her where we treated in the neck area, the cheek area, and also around the brows to lift the brows, lift the jawline, lift the neck. And we'll do one pulse here just so you can get a sense of it. But this is no downtime. It takes about an hour to do. And it's just all these little lines. A typical procedure, we do about 600 to 800 of these pulses, which we call lines, and over about 3 to 6 months, it causes collagen generation and tightening of the skin.
So this is something that you would do every, say, 3 to 6 months, or you do one time and you're good?
It's FDA approved for a year. You probably get a little longer out of it, but I always talk to patients about maintenance. You know, we're always constantly fighting aging, so there's a little bit, kind of like getting oil change for your car. You want to keep up with things. So whether that's once every couple of years, or for some people, a little bit more frequently, a little less frequently, just to keep things nice and taut.
Wonderful. Well, you have beautiful skin, so whatever you're doing, it's working, and you too, Sarah. Dr. Palm, thank you so much for coming in. You're at Art of Skin in Solana Beach. Beautiful new office.
Yes, we're very proud to be there.
Thank you so much, Dr. Palm. Okay, we'll let everybody get back to their treatments. Coming up here on Good Morning Sandy.